All right, trying to get this all set up here. Just a moment. Okay, so we are happy Monday. We're back on Facebook Live here. Today we are going to talk about rotator cuff injuries and shoulder pain and what it is that you need to know about it. So some pretty awesome stuff, and I get asked questions about shoulder pain and rotator cuff issues all the time. If you have any questions while I'm going, don't hesitate to stop me. Just drop a question in the comments, and I'll try and get to it as we go here. And if I don't get to it, I will get to it afterwards. So like I said, what we're going to be going over is shoulder pain and rotator cuff issues, what it is, what is the rotator cuff, what does it do, how do we treat it. Thanks, Chase. Thanks a lot for that like. And if you do like this video or you find it helpful, please like it. Give me a thumbs up or love it. Feel free to share it with your friends. So really appreciate that and all the support. How's it going, Angela, Leonard, Zahn? Good to see you guys. So we're going back. So what is the rotator cuff? What does it do? How do we treat it? And do you need surgery for your shoulder pain, for the rotator cuff? These are pretty frequent questions that I get asked all the time, and really try to help people to solve their issue. And everyone's a little bit different. So that's kind of one of the first takeaways is no two people are the same. And this is just a very frequent issue that we see every single day, day in and day out. So diving into what is the rotator cuff. So a lot of people, when they come to physical therapy or see me, they're like, I got this issue. Doc says it's, a rotator cuff, or sometimes they'll call it a rotor cuff. I hear it called all kinds of things. So it's rotator cuff. The main function of it that I teach people is, while it does do rotation and it rotates your shoulder like this, okay, into external rotation, that's not the main function of this group of muscles. So the rotator cuff is made up of 4 muscles, which are on your shoulder blade, and also are involved with what we call the glenohumeral joint, or that ball and socket joint on the shoulder. Those muscles are your supraspinatus, your infraspinatus, your teres minor, and your subscapularis. So those 4 group of muscles make up the rotator cuff. And the main function of it, like I said, it's not rotation, it's actually dynamic stability in that joint. So the main function of it is to keep that joint moving correctly, that ball and socket, just like this. So if this was my humerus, and here's the ball, okay, and here's the socket, it needs to keep that bone, that ball in the socket as it moves around, especially with overhead movements. Your throwing athletes, your overhead athletes, if you're doing any reaching overhead, lifting, it's really helping to stabilize that joint. So that way, you're not gonna dislocate. So it's just another form of protection and stabilization for that shoulder. So that's kind of just the basis of what the rotator cuff is and what it does. So next, going into how do you determine if you have a rotator cuff injury? How do you know it's your rotator cuff and not something else going on? Well, there's a number of different tests that you can do and measures. A lot of times these people will have issues with reaching behind their back. Putting on a coat's really difficult. Reaching overhead's difficult, especially to the side, this motion here. Sometimes they're reaching out, grabbing a gallon of milk, and they get sharp pain when it's out in front of them, that weight is. That can really tick it off if you do have an issue with the rotator cuff. How do you know it's torn versus like an impingement? So with an impingement, a lot of times, so what happens is you got some irritation at those tendons, and when you're doing some overhead activity, that muscle's getting impinged with the bone is kind of the just very simple way to put it. It may or may not be what's happening, but versus, a tear. You got a tear in the muscle, there's a strain there. But either way, regardless, with either of these, what we've found is that conservative measures can really help with shoulder pain. And when I say conservative measures, that's meaning like physical therapy, some therapeutic exercises, massage, manual therapy techniques. All of those can really help. You don't necessarily need to have any injections or any surgery. Now, sometimes that can be effective, but as far as like surgery and injections go, it's definitely not the first thing that I turn to. So, hey, Ryan, hey, Tim, thanks for joining. Again, if you guys have any questions, please drop them in the comments. They've done research, and with full thickness rotator cuff tears, where you might not be able to raise that shoulder at all and move that arm, you're kind of doing this to get your arm up because it won't move, and you have full range. You could take your arm and you can lift it like this over your head. Sometimes they've actually shown that conservative measures, and it can be just as effective as surgery, and that you don't need surgery. So that was pretty shocking to me when I first saw it, and it really helped change how I treat my patients and what I recommend to them. So I definitely do not recommend necessarily, and again, it depends on everyone, but with a lot of people now with these rotator cuff issues, I'm telling them, hey, let's get going on conservative measures first. Let's see how you improve there with physical therapy and with the exercises, with a good home program that fits your needs, before we go into any surgery or talking about surgery or anything like that, because it's definitely a rough surgery to come back from. It's definitely doable by all means, but let's try physical therapy first before we get into that, because then there's some complications with surgery that anytime you're going in, even if it's arthroscopically, there can be complications after. There's a risk. You're going into the body and making some changes. So if you can avoid that, why not? Why not save yourself the pain of dealing with some stuff in the future? If you're watching this, you're probably wondering, okay, Eric, that's all great. What are some things that I can do right now to help with my shoulder? So just some basic things that I would recommend. I have different exercises that I do give to people. I've got 3 different exercises. So some of those include like doing a ball on the wall, doing some small circles, and then really focusing on some exercises that are going to help with that stabilization. So, if that sounds like you, and if it sounds like what I've described, that reaching behind, that reaching overhead, reaching behind your back, especially lifting things out away from your body, if that's causing you shoulder pain and you want some of my top exercises, I'll give you pictures of those. So that way they're less confusing, some pictures and video and description of those. If you want them and you're serious about it, please just drop your name in the comments below. So just drop your name down there and I'll message you, and we can, I'll get a hold of your email and I'll just send you those right over to you. No problem at all. So again, if you're having any issues with your shoulder and it sounds like, hey, I'd love some of those exercises that you're talking about, Eric, feel free, drop your name in the comments below, and I can help you out there and send those to you. So Patrick says, I think that my rotator cuff hurts because my hips might not be aligned properly. Could this be the cause? If so, what are some exercises or stretches I could do to help realign my lower body to help? So Patrick, and then Chase says, Habs Boston fight. I'll have to catch that, Chase. Hopefully, I don't even know who I want to win that one, Habs or Boston. Probably, I hate Chase Marchand, or not you, Chase. I'm sorry, Brad Marchand. You guys have the same last name, very confusing. Brad Marchand, can't stand that guy. If he's in the fight, I hope Habs win. But Chase, love you. Did not mean you. But Patrick, thanks so much, Patrick, for liking this. Again, if you guys like it, if you want to give me a thumbs up or love it. Patrick, going back to your thing, could your lower body alignment affect the shoulder? I would say it depends on what you do. what is it that you're doing all day? And a lot of times, though, I think we get way too caught up into what alignment or what role alignment plays on the body. So, if we took an x-ray of you, we're going to find something. So, I know with a lot of chiropractors, that's one of their go-tos is doing an x-ray to see, whether your spine's aligned. I'll do some of that stuff and some muscle energy technique, but I really don't focus on that. So I would say the likelihood that hip alignment issue is affecting your shoulder, I would say it's probably slim to none. It's probably more an issue of what are you doing all day that really is ticking it off. Which, hey, get a hold of me and I'd be definitely, I'd love to help you out there. So I think it's more of an issue of what you're doing and how you're doing it versus a hip issue. I could be wrong. It could be, it's tough to say over video without specifically saying what you're doing and how it's going. But yeah, shoot me a message and we'll talk. Chase says what? Chase, I don't know if you're talking about me stumbling over my words there or about what I was saying about Brad Marchand. I accidentally said Chase Marchand just because you guys have the same last name. But yeah, Brad Marchand, one of my least favorite hockey players out there. Chase Marchand, one of my more favorite guys to play with. So always a good time on the ice with you, buddy. Yeah. So again, if you guys have any other questions, let me know. Put them in the comments. I'm more than happy to answer them as we go here. And if you want those exercises that I was talking about, drop your name in the comments below. I'll message you, get your email, and we can send those over to you. So again, to recap, the rotator cuff's made up of 4 different muscles: your supraspinatus, your infraspinatus, your teres minor, and your subscapularis. And the main function, it does do rotation of the shoulder, but the main function is stabilization of that ball and socket joint and helping with dynamic stability of that shoulder joint there. And then, to recap, surgery, not always necessary, especially right away. Go with conservative measures first. And, if you have any questions, really get with your local physical therapist. They can definitely answer those if you have questions there. Or, shoot me a message. I'm more than happy to answer those for you. So I hope you guys found this helpful. If you did, please give it a like or love, and then share it with anyone that you might find that really has shoulder pain and is affected by this and would find this video helpful. So thanks so much, and we'll talk to you guys later. Have a happy Monday.